As we're all watching the race in the US, what are you watching in terms of the number of cases of people infected with COVID-19 in the US?
Well, we've reached really incredible numbers of COVID-19 cases. We've had 2 consecutive days of over 100,000 new cases across the U.S. And at this rate, by the time I talk to you next Friday, we may be at 10 million cases within the U.S. alone. And again, those are just astounding numbers. And we're not seeing the types of public health intervention responses that we need to turn the corner on this. Based on policies that are coming from both the federal government as well as from many state governments.
Do you expect a change of tone or a change in how we deal with COVID-19 in the US if there's a change in president?
Well, I think everything that's been talked about within the campaign suggests that yes. But the important thing to remember, though, is that while the election is going on this week, the change in presidency won't happen until the middle of January. And so we've got these winter months, which are looking like the case numbers are increasing at a tremendous rate. And those need to be dealt with on a sooner basis rather than waiting for the change in administration. So that's the real concern. We're going to see hospitalization rates lag behind case rates. So we're seeing some hospitalization rates go up in various states now. That's only going to continue to rise. And it's that burden on the medical infrastructure that is going to be the really critical thing that's going to be dealt with over the next couple of weeks.
But Andrew, if you look at the hospitalization rate compared to the number of infections rising, it seems to be actually less violent in terms of the number of people that end up in hospital than it was back in March and April. Why?
So it's an important point. Some of those fatality rates and some of the hospitalization rates are a little bit lower now. There may be a few reasons for that. Number one, the demographics of the people who are getting infected is turning into a younger age. And we know that in younger age groups, the disease severity rate is reduced. It's not zero, and it's still very significant, but it's not as high as it is in the elderly, for instance. And then secondly, the fatality rate is getting lower too, because the medical institutions in the United States have really learned a lot during the first wave of COVID-19 cases, and they've really learned how to take care of the seriously ill patients, and that turns into much better outcomes overall. So there are certain things that we're better prepared for now. I think the medical infrastructure is better prepared to deal with cases. Surges, there are plans in place at least to have secondary hospitals open up and secondary beds open up. But the important thing to remember, though, is we don't need to be preparing at that level. The public health interventions that we know work, the physical distancing, the avoiding large crowds, wearing face coverings, those are the things that we know can reduce the total number of cases, and that has the trickle-down effect of then reducing the severe cases and the hospitalizations and the overall deaths. And that's the place where we really need to make a stronger effort here in the U.S. and perhaps globally as well.
Andrew, what's your expectation about a vaccine? I know, we've entered stage 3 trials. Is a vaccine to make sure that people don't get the disease, or would it be enough if the vaccine basically reduces your chances of getting into hospital?
Yeah, great question. We expect over the next few weeks to start to hear the preliminary reports from the vaccine studies that are going on right now. We won't have the final reports for some time now, but we'll at least get the first 10,000, the first 20,000 individuals who have gotten the vaccine and have a better understanding about the safety and how your immune response, how great your immune response is to that vaccine. That should set the stage for us to really understand what these vaccines are going to be doing in terms of a public health intervention. Ideally, we hope to see a relatively high immune response and a high vaccine efficacy rate, because that will limit the number of cases that are spreading, as well as disease severity. But it may be that the effect is going to be a little bit more on disease severity, meaning that we still may be getting people who are infected, but they'll be able to deal with the disease better because they've already got a primed immune system. And once they get infected, their immune response will rev up much faster. So that's really the critical things, and we're going to start seeing those preliminary reports over the next few weeks, and that will really set the stage for how these vaccines are going to be rolled out. But that probably won't happen until the new year.
Andrew, in 30 seconds, are you comfortable once we have the solution that we'll be able to distribute it okay?
Yeah, many people have been working on the distribution networks. I think that it's really going to be a question of prioritizing populations. Who's going to get the vaccine first? Because we can't immunize everybody at the same time. And various states are putting in place their plans for priority populations, so that once the vaccine becomes available, you can relatively quickly move those into vaccine distribution networks. We have influenza vaccine distribution as a model for that, and hopefully that will be done very efficiently.